Guys, I wish you high spirits. In this video, we'll take a look at a small but very important muscle in our body, supraspinatus muscle, which can be the reason of the development of pain in shoulder joint and arm with epicenter in the deltoid region, and also cause clicks in the shoulder joint when the hand moves. I will show you exercises and useful recommendations using which you can eliminate pain at home and prevent its future reoccurrences. I'm the Dr. Sergey Chernov. Press the thumbs up and subscribe to the channel. The anatomy of supraspinatus muscle. The supraspinatus muscle, almost completely covered by the trapezoidal muscle, at the point of its attachment by coracoacromial ligament, is also by the deltoid muscle. It starts from the walls of supraspinatus fossa of scapula and narrowing its heading to the outward, passing under the acromion scapula and attaching to the upper edge of the humerus. The function of supraspinatus muscle. The main function of supraspinatus is abduction of the shoulder and also stabilization of shoulder joint, and preventing the shifting of humerus head down when the arm is dangling along the torso, especially in cases when the arm is loaded with weight until it's completely exhausted. For example, when you carry a heavy bag for a long time, and also while sudden arm down. Trigger points of supraspinatus muscle. Trigger points in the supraspinatus muscle cause pain in the region of the shoulder joint and downwards of the upper extremity. Triggers that are in the muscle center and close to its medial edge provoke deep and long-lasting dull pain in the shoulder joint with epicenter in the deltoid region that can go down the arm, concentrate in the area of lateral condyle of humerus, and even reach the forearm, switching to the wrist joint. Pain in the elbow joint area can be a diagnostic difference from pain that is caused by trigger points of infraspinatus muscle. The trigger point that locates at the lateral edge of the muscle at the attachment site of the supraspinatus muscle tendon to the shoulder joint capsule provokes pain only in the deltoid region. Pain can increase while forced abduction of the arm and also can take place at night, disturbing your sleep. In severe cases, the hand cannot be raised above the shoulder level. Some people can have clicks or crackling on the shoulder joint region while the hand is moving. It happens because tensed supraspinatus muscle interferes normal sleep humerus head in the shoulder joint. The clicks can entirely disappear after eliminating trigger points. If supraspinatus muscle is affected only on the side of the leading arm, then, in this case, due to limited shoulder abduction in the shoulder joint, there will be problems with combing hair, brushing teeth, and shaving. Limited mobility and pain could become a real problem for training athletes. For example, volleyball and tennis players could face hardships while pitching. Trigger points in supraspinatus muscle can be activated during any severe overload, for example, while lifting heavy bags, huge boxes, when arms lower downwards are slightly sided, or while walking with a big dog. If it pulls on the lead, or while doing work that requires prolonged arms lifting, for example, while installing suspended ceilings, any intense exercises with dumbbells when arms to the sides, or for example, bench press from behind the head, could also provoke activation of triggers and the development of this pain symptomology. The supraspinatus muscle is rarely affected in isolation and almost every time combined with upper trapezoid muscle and also with infraspinatus muscle, because the main area of reflected pain from the trigger points of supraspinatus muscle is projected on the deltoid muscle location. Then, when pain occurs in the shoulder joint region, we should also look for trigger points there. Also, the widest back muscle could be incorporated in the pathological process. While being an antagonist of supraspinatus muscle, therefore the muscle that performs the opposite function, bringing the shoulder, elimination of trigger points in it, and relaxation in the widest back muscle will increase the angle of shoulder abduction. Therapeutic exercises. For working on the supraspinatus muscle at home, you can use mechanical action technique on the trigger points, followed by stretching of the affected muscle. Find the spine of scapula on your body and supraspinatus fossa that is above it, in which there is the supraspinatus muscle. Then take a tiny massage ball of 8 cm and come to the wall. Roll the muscle to the right and to the left as its fibers move during 1-2 minutes. and then, having found the zones of tension, have even more strong mechanic impact on them during 30-60 seconds. More intense impact on the area of trigger points you can have while lying on your back, under the weight of your own body. But at first, it can be a very painful procedure, especially if you have a large body weight. Be sure to roll the muscle the same way on the other part of the body. Since the primary function of the supraspinatus muscle is the abduction of the shoulder in the shoulder joint, then it will be maximum stretched while bringing your shoulder with your hand behind your back. Point your arm on the affected muscle side behind your back and lift your hand towards the head. Raise your other hand above your head. Reach your fingers towards each other, trying to make a carpal lock. If the pain when doing this is severe or there's a significant restriction of hand mobility in the shoulder joint, then take a belt, loop for yoga, towel, or even a regular sock and grab it with your hands as close as you can get today. Hold the end position within 1-2 minutes. While stretching the muscle, breathe deeply and quietly, and with each 4-5 exhalation, try to get your hands a little closer together. The supraspinatus muscle stretching at home can also be done under a warm shower. Do the same exercise by sending a stream of water to shoulder blades area. In my yoga workout sequence that are gathered in this playlist, there are hand grip behind back exercises. The ideal variant at home is myofascial release of all muscle of your body, focusing problem areas by stretching the key muscle groups in the form of a fully balanced yoga complex. In the long run, this is a better option than an isolated exercise for only one muscle, in this case for supraspinatus one. It should be understood that if the supraspinatus muscle is in the chronic tense, then this is most likely due to uneven muscle development in the shoulder joint area, and other antagonistic muscles could be in a weakened state. To form the evenly developed muscle corset around the shoulder joint, and thus to contribute preventing the reoccurrence of trigger points in the supraspinatus muscle, I highly recommend, in addition to practicing yoga, to learn at least a few simple exercises with a stick. I recommend to integrate these exercises into your life, not only for those who has problems with the shoulder joint, but also in general with arm, cervical and thoracic spine. They are discussed in this playlist. Guys, thank you for your thumbs up and subscription to the channel. Also watch the video about the deltoid muscle because it's connected with our today's topic. Be in good health and see you soon.